was inspired to become a physician really through a multitude of factors. I have a long history of healthcare providers in my family. My great-grandmother was a midwife in my family's home country, Jamaica. I'm a first-generation American, so I always kind of had a predisposition towards healthcare. But really what cemented my journey into medicine was my experience in Howard University, where I went to college, and seeing kind of the disproportionate care that they got in Washington, D.C. versus more affluent areas. And so wanting to kind of help fight those health inequities is what led me to wanting to pursue a career in medicine. I majored in sports medicine and health and human performance when I was in undergrad at Howard. When I graduated, I went to the University of North Carolina in Chapel Hill, where I got my medical degree. After that, I did a preliminary year of internal medicine residency training at East Carolina University, and then I did my specialty training in physical medicine and rehabilitation at the University of Miami in Florida. And then after that, I did a pain medicine fellowship at Dartmouth in New Hampshire. And then I moved to Georgia. My area of expertise is physical medicine and rehabilitation, or physiatry, as well as subspecialty certification in pain medicine. PM&R, or physical medicine and rehabilitation, basically what I do is I specialize in non-operative management of any chronic condition or any condition that is debilitating. In an orthopedic setting, that's more commonly musculoskeletal pain or joint pain. I would say that the majority of the folks that I see have chronic pain involving their neck and in their back, although I also treat larger joints as well, such as hips and shoulders, non-operatively. My passion is improving functionality, increasing quality of life, and the advice that I would give to somebody who's looking or considering coming to a physical medicine and rehabilitation specialist is to communicate what your goals of care are, because that may look very different for somebody who, say, their daughter is getting married next year and they want to walk them down the aisle, versus somebody who is an athlete and their goal is to return to play. What I don't want to do is assume that I know what's best for the patient and then dictate to them what they need to do. I want to know what they want out of their encounter, what they're looking for, and then try to construct a plan based on what their goals are in order to best suit their needs. What makes Piedmont Orthopedics Ortho Atlanta different from other practices, I would say, is kind of the multidisciplinary, collaborative nature of the group. We have people that work well together and that specialize in different areas. So we have upper extremity specialists, foot and ankle specialists, non-operative spine specialists, and operative spine specialists. And so if there's ever a scenario in which I feel that you'd benefit from another set of eyes, then we do have people that are very subspecialized and very well trained in specific areas that can weigh in as well. We all communicate frequently with one another. We'll all talk on the phone, or we'll touch base directly in the office to make sure that we're coordinating care in the best way possible. And I think that that type of collaboration enhances patient care and then improves outcomes as well. I see all adults. Occasionally I've seen teenagers, but the majority of my practice is comprised of adults. Getting that feedback from the patients that they were able to accomplish the goal that we had previously set out for them, that's what kind of gets me up in the morning and what keeps me coming back. I would also say that education, being able to empower people with knowledge of their condition so that they can know how to manage it going forward and feel more confident and comfortable with what's going on with their body, seeing that and getting that feedback patients that they now feel comfortable, even if there's not a cure per se. Those are the types of things that I really enjoy about my job.